I have a couple of guests in the studio with us, joining us today. We were talking about this last week, Breast Cancer Awareness Month, and I had pointed out that most people know it happens, and whether it's, I guess it's fortunate. Some people might say that it's not perhaps in depth enough, but because for recent years the National Football League and some other sports leagues have actually engaged in this, and you would tune in and wonder why are they wearing pink, and you'd mention that to a friend, and they would tell you that's because it's Breast Cancer Awareness Month, and the idea is to get you thinking about that, but doesn't necessarily go into a lot of depth. So what we're doing is we're having guests come by throughout this month, and they're going to be joining us on Top Story on News Radio 1310 KLIX and newsradio1310.com, and they're going to be talking about some aspects of all of this. We got a great overview last week from Arnie Walker. Arnie's back in studio with us today, and of course, he's brought along a guest with him too as well, Dr. Robert Lobb. First of all, welcome to the two of you. Thanks for joining us.
Thank you for letting us be here.
So today, a little discussion about what you're doing, I think, Doctor, with your efforts at the Wellness Center, right?
Yes, I volunteer over there on Mondays and have a clinic pretty much every Monday when I'm in town.
You know, there's a quick point to make here. There used to be all of those, when you'd read the funny pages when you were kids, there were all those jokes about doctors playing golf all the time. And I know that at my own doctor's office when I was a kid, we'd go there. I don't know where he found the time to do anything but be a doctor, because he'd start at sunrise in the morning and still be there at 8 o'clock at night. But people don't realize that people got into the medical professions because of a desire to help, and that you do a lot of this in your time. You have time that you actually volunteer in various areas.
Absolutely.
When you're there, what is your goal? Just to ensure that people can get the treatment as quickly as possible?
Well, my goal is to make sure that they get some treatment. The problem with our demographic is that they're all poor. They do not have insurance. They may or may not be working at all. And they have health concerns that actually have been going on for a long time, in many cases years. And this is an opportunity for them to actually see a healthcare provider who is going to take an interest in what their problem is, and also come up with a solution as to how we can either investigate it, start a treatment program, whatever is needed. So a lot of those treatments can be, and investigations, x-rays, labs, etc., can be taken care of through our clinic and basically are done for free or close.
I was going to say a lot of people out there perhaps shy away from even asking the questions because they're of the belief there's nothing that can be done.
Correct. That's absolutely correct. And they're very worried about the cost. And they don't have two nickels to rub together, and so the last thing they think is going to be important for them to do is to go to a physician, find out they've got a problem that needs an investigation like a CAT scan or an MR or something very expensive, and find out they can't do anything with it. But there's a lot of ways to skin a cat, and sometimes we just have to be a little bit imaginative to get it done.
Arnie, I was going to say, we talked a little bit about this last week, but the center is designed to take advantage of whatever is out there. And you almost have to be, you can't just learn it once because things change and there are new programs and the
Very
like
true.
that come and go.
Yes. And there's a lot of different resources here in our community and in our country as a whole to provide health care at free or very reduced costs. So if the patient needs a service that we don't provide at the Wellness Tree, we often can find that service that's needed at a free or reduced cost somewhere in our community. But it just takes a little time, knowledge, knowing what paperwork to get completed and send in. So we navigate and help our patients get through that process so that they can get the care they need when they need it.
Dr. Lobb, I know that the diagnosis is and I've known people that have gone through this. It's crushing to get that in the beginning. But on the other hand, you can offer them, I think, some sort of emotional release by knowing that they're not going to be crushed by debt with all of this.
Correct. And specifically in regards to breast cancer, um, it's somewhat sad that we have to use the diagnosis of cancer, the word cancer, when you're sitting down in front of a woman who might be in her mid-50s who thought she was well and then finds a lump and boom, gets a mammogram and a biopsy and she's got cancer. The first thing that goes through their head, if anything is going through their head at that time, is that this is going to kill them or it's going to make them very, very sick. The treatment's going to make them very, very sick before they can start to get well again. And it's kind of important to realize that there are some cancers, especially in situ breast cancers, which means a very, very, very small tumor that's confined to a duct or a lobule that can be found early now that we have all these amazing ways to do mammograms. Mammograms have really been developed over the past 20 years into something that used to be a gray picture to almost color. And so we can find these cancers very, very early. What we don't know about the biology of breast cancer is what is your body doing to that very, very small in situ cancer? Is that in situ cancer going to spread? Is it going to become invasive? Or is your body going to confine it and maybe even defeat it? One of the major moves afoot right now is to make sure when we sit down and talk to a woman that has a cancer, that she understands that there are options. There's even options to observe as long as it's not lost to follow-up, so that periodically a breast exam is done, a mammogram is done, perhaps more so than just yearly, as is the advice of the Cancer Society, but they can be observed. And a lot of women can take that risk. They feel good with it. It's okay. It's an alternative, and they'll go with it. A lot of women won't. A lot of women will say, if I've got cancer, I want it out of my body. And
hold that thought for a moment. Dr. Lob and Arnie Walker with us for a few more minutes. We have a short break in the meantime with some of our fine sponsors as well on the way. We've got more details coming up, including a little bit about how you could get in touch, I think, with the Wellness Center as well. 20 minutes away from 10 o'clock. Bill Colley with you as well on Top Story on News Radio 1310 KLIX. I have a couple of guests in studio with me, and we're talking Breast Cancer Awareness Month, and Dr. Robert Lob is in the studio with us, who volunteers some time on this very important issue and offering people advice and pointing them in the right direction and getting them where they need to go. Arnie Walker as well with us from the Wellness Tree, and which is an organization really devoted to reaching out to those people who might not otherwise have an opportunity or believe they don't have an opportunity and might be frightened even about going somewhere because of fears about costs when it comes to cancer treatment and the like. You're listening to Top Story with Bill Colley on News Radio 1310 KLIX and newsradio1310.com. 9:43 and 52. First of all, Arnie, if someone needs to get in touch with you, a lot of people hearing this might be the first time they've ever heard about this, that there's this opportunity.
Yeah, the Wellness Tree started very small about 11 years ago here in Twin Falls. We're now located in the old Magic Valley Hospital in the area that used to be the emergency room. So we're right here in Twin. We're easy to find on the back side of the old hospital. Our website is wellnesstreeclinic.org. You can check out more information there or just call us if you have questions. Number is 734-2610. We're open Monday through Thursday for daytime appointments from 9 to 4. You need to call ahead and schedule that appointment. Then we have evening walk-in clinics on Tuesdays and Thursdays, and those you don't need an appointment for. So give us a call if you have questions, and we'll direct you to the right time, right place to come and see a physician.
There's a great portrait of all of you, too, on the website. Everyone outside, I think, on a picture day.
Yeah, and that picture was taken on the day that we started a project to build a free dental clinic in the Wellness Tree. And we just got that dental clinic up and going first part of June. And our focus has been getting people out of pain, oral pain, and we've already extracted over 250 rotten teeth and just making a huge difference with oral health issues here in our area.
And Dr. Lob, of course, was chatting with us a few minutes ago about the various patients that he sees when he's at the Wellness Tree on Mondays, as you pointed out, is your day there.
Correct.
And you were talking, we were just starting to get into a little discussion about prevention and what people should really know ahead of time. That may mean that they never actually have to have any, there's always going to be concern, but at least you can reduce that fear.
Yeah, the major goal for identifying, treating breast cancer is early detection. So The rule of thumb is that if you're a woman and you're 20 years old, you need to start doing self-breast exams, and you need to do it well, so you need to learn how to do it. You should see a primary care provider who knows how to do that and show you how to do it, and then you need to see that same primary provider approximately every 3 years until age 40. There's some discussion about whether 40 is the right age to start getting mammograms or it's 50. I don't think we'll need to get into that, but you can work that out with your primary care provider. And then on an annual basis, not only a thorough exam by your primary care provider, but also a mammogram. And everybody needs to kind of understand that most breast cancers occur after the age of 50. Not all, but 70 some odd percent, 77, 78% of them occur after age 50, and 50% of them are diagnosed after the age of 65. So the older you are, that's a definite risk for increased chances of developing breast cancer. So you see your primary provider because you've found a lump. The primary provider will most likely send you to an X-ray department where you'll have a mammogram. The mammogram may be done at the same time as an ultrasound to determine whether it's a cyst or not, whether it needs to be biopsied or not. If it needs to be biopsied, then that can be set up. It can be done either in the operating room or actually in the office with a needle, and that is sent to a pathologist who then looks at the tumor or the material under a microscope and determines whether it is breast cancer, what kind of breast cancer it is, and there can be an evaluation as to whether this is an invasive or an in situ breast cancer. And then the woman and the primary care provider, maybe even an oncologist, can sit down and have a frank discussion about where to go, what to do, what are my options, and the woman has to be part of that decision-making process. And then a treatment plan is either laid out or an observation period. So that's the basics. Now, for prevention, there are some lifestyle things that are somewhat important. Your risk is highest, I should say, if you've had breast cancer before, because you're most likely to have a recurrent or a new breast cancer as a result of that experience, or you have a first-degree relative, that would be a mother, a sister, or a male in the family that has breast cancer. That also significantly increases the risk. There are some genetic factors that require some specific testing. If you have a very positive family history of breast cancer, that determine whether you also are at high risk and may have to do some things to prevent breast cancer from occurring. And then there's also lifestyle. Well, there's another category that's not as common, but if you've had irradiation to your chest or chest wall for whatever reason, that at some point in your life, like for the treatment of mastitis when you were in your teenage years, that will increase your risk of breast cancer. So the lifestyle things are the usual ones. I mean, if you're not exercising, that increases your risk. If you're overweight, that definitely increases your risk. If you smoke, your risk is increased. If you started menstruation before the age of 12, that increases your risk. If you went through menopause at a later time in life, late 50s, that increases your risk. If you take birth control pills, that increases your risk. If you're on hormone replacement therapy, estrogen, progesterone for menopausal symptoms, definitely increases your risk.
We've got to wrap it up there. Mike Gallagher is on the way in a minute, but I'd like to thank both of you for coming by this morning. And hopefully we've reached someone each one of these days and that they'll be giving you a call. Gallagher straight ahead. You're listening to News Radio 1310 KLIX.